put our management under the Sarawak General Hospital. So welcome today. These are the SHLO updates based on the latest Annex 21A by KKM for the management of positive healthcare workers and also the close contacts of healthcare workers. But we have actually put our management under the Sarawak General Hospital management, like a local protocol. Okay, right, we'll start. Okay, so what are the things that we're going to see today? We're going to look at the statistics of the latest healthcare workers positive trend. Then we'll look at the latest update on the management of close contacts in Malaysia and also practiced by all the hospitals in Malaysia. And we've actually prepared some scenarios, the common scenarios that will help with the management later. And we have a question and answer session at the end. So feel free to ask me questions at the end. Okay, all right. So we'll start. This is actually the trend of the SGH COVID positive KKM staff in the year 2022 by EPID weeks. So EPID week, currently we are in EPID week 9. So if you look at this trend, we started off with just 2. We did not have any positive healthcare workers in EPID week 2 and 3. Subsequently, EPID week 4 slowly it was increasing. And then 5. And suddenly we had a huge jump to 11. This was actually during Chinese New Year period. Yes. And the next week after that, we had a very steep increase of 33 extra. So we have 44. And EPID week 8, which is 2 weeks after Chinese New Year, we actually have 107. So the jump was really huge. There was a sudden surge and a lot of our healthcare workers were becoming positive at a very rapid rate. In average, we have 30 to 40 healthcare workers who are positive in the last 3 days. Yeah. So here 67, it is just because it goes by weeks. So what's reported here is 67 healthcare workers were positive since from last Sunday, Monday and Tuesday. Okay, right. Okay, so what is the update? Okay, in view of having such a surge and the OSH team being unable to contact trace everybody, we have actually come up with a workflow that can actually help us catch the positives faster and also at the same time empower the close contacts to start managing themselves first before waiting for instructions from OSH. This is because due to the high traffic, we are unable to actually meet the requirements for both categories. The positives were going up and then the tracings were also going up, and we realized that we have been constantly tracing the same group of people because one department can have up to 20 to 25 positives within 3-4 days, and the same group of people are being contact traced. So we decided to do something which will actually help us streamline a lot of things, and the healthcare workers who are close contact can actually empower themselves by doing the first line management at least and decide how to go about and not delay the workforce and also not put workforce into burden. Okay. So looking at that, so the OSH team will no longer be actively contact tracing close contacts. So we have stopped. No contact tracing links will be sent out with effect of 1st of March 2022. Meaning after this, when a positive is reported to us, we will no longer send a contact tracing link to actually trace, code, plan for the testing, and then sending out the PDF and all that. Okay, we will go straight to the Annex 21 protocol. Okay, all staff will report to the SHLO respectively for further management, and this is based on the latest KKM Annex 21A protocol. So the SHLO will be the sort of a manager that will actually know what's happening in the department. The staff they would be the first reference to the staff, and if at all there's any problems, the SHLO can contact the OSH MO on call and we are readily able to help. Okay, so all positive healthcare workers will be guided to the workflow once they have filled up the positive healthcare worker link, which we have actually inserted together in today's presentation. So there is a flow for the positive healthcare workers. Once they filled up the link, there will be instructions on how to move forward after that. So there are a few things that they have to do. They have to make sure they get their home surveillance order, that is via MySejahtera, because now we are no longer taking out manual HSO unless it's necessary. All positive will have to show their MySejahtera HSO as proof of their quarantine, and even their release order is digitally available nowadays. Okay, so all that will be guided once the link is filled up, and subsequently, if there's anything, they can actually call the SHLO on call. COVID positive staff who are unwell post-quarantine, meaning after they have completed their HSO given by MySejahtera, still having symptoms, still unwell, will have to contact the SHLO on call for further management. If you have contact with a positive source, okay, this is where we start. So if you have a contact with a positive source means it could be anybody who is COVID positive. So before I proceed, we have accepted STK positive as COVID positive. We no longer require a PCR as a confirmatory to a STK which is positive. If there are symptoms and STK positive, yes, we will proceed with PCR positive. We will proceed as positive. We do not need a confirmatory PCR. Okay. So once you have a contact with a positive source, what are the 3 questions that you have to ask yourself? The first, what risk am I? Which risk group do I belong to? The second question, do I have symptoms, even of the mildest one, sore throat, dry throat, dry cough, sneezing, flu? Do I have any symptoms? And what do I do next? Okay, so now we will go towards it. So risk stratification. What is my risk? Now we only have 2 risks, which is low risk or high risk. There is no medium, there is no intermediate, there is no yellow, red, green coding that we used to do last time. Yeah, it's just low risk or high risk. So close contact risk categories are well described in these 2 definitions. So if you're low risk, it means the healthcare worker is wearing a mask and the source person is wearing a mask and a face shield. Okay, so if both parties are wearing a mask, it's actually a low risk category. High risk category is healthcare worker who is not wearing PPE according to the infection prevention control guidelines, and if they're household contacts, meaning at any point where there is contact between a staff and a positive source without mask, or any procedure that doesn't meet any procedure done without the adequate PPE, or their household, because at home nobody really wears a mask, they are all considered high risk. Okay, we have a few scenarios, so I'll help you with that later on. Okay, so how do you know if you're a high risk contact? We have actually listed down a few descriptions to actually help the staff identify if they're actually high risk contact. Okay, so if you're a high risk contact, you have close exposure without face mask with another index who was also not on a face mask for more than 15 minutes, less than 1 meter, or you're not wearing PPE according to the infection prevention control guideline when you're treating a positive patient, testing samples of a positive patient for more than 15 minutes during one work shift without fully adhering to good laboratory practice. You are living in the same household as a positive case, living, sleeping, sharing a common accommodation, sharing kitchen, bathroom facilities, or sexual partners with a confirmed COVID-19 person. Okay? Alright. So this is the highlight of the whole presentation. This is where everybody will actually go back to once they have risk categorized themselves. Okay? So there's only low risk, and high risk. Let's start with low risk. If you're a low risk close contact, okay, so that means the healthcare worker and the source person is wearing mask. The source person is the COVID positive person. The first question to ask, do I have symptoms? Okay, if I do not have symptoms, should I do a RTK antigen test? No. Can I return to work? Yes. Do I need to be monitored? Yes. Self-monitoring is done. until day 14 of last exposure. Okay, so this is for those who are low risk close contact with no symptoms. We move on to low risk close contacts with symptoms. Do I have symptoms? Yes, I do. What do I do? Immediately, a RTK antigen test. And then subsequently, can I return to work? Yes, if the RTK antigen is negative with strict precaution. Meaning, if you have symptoms but you are low risk, there is a chance that you could be positive. So the first RTK antigen is negative, you can go to work, but you need to adhere to strict work restrictions. Face mask, face shield, avoid eating with people, or avoid eating with a group of people, avoid attending CME sessions that involves eating after that, because you will have to remove your mask and eat in a closed environment. A surau, try to pray when there is no one around, you have to take precautions, because if your symptoms persist, you will have to repeat your STK. And we have been having healthcare workers who have got first 2 days saliva test negative, and the third day they test positive. But the first 2 days they've already gone out because they're negative, so they expose themselves to all the others and risk everybody else. Okay, so once the first test is negative, can you return to work? Yes, I can. But if the symptoms persist, please declare. Please declare in a link that we will share later. It's called the symptomatic link, okay, where we will re-evaluate your symptoms and we will give you MC until your symptoms are resolved, or we might need to proceed with the PCR if needed. Okay, so this is how it is. But if just say your first RTK is negative and subsequently your symptoms resolve, so probably it's just a viral or allergic rhinitis or something like that, okay, self-monitor symptoms for 14 days. Okay, so now we go to high risk. If you're a high risk contact in which the healthcare worker was not wearing PPE according to the protocol, and if they're exposed to a household contact that is positive, the first question, do you have symptoms? No. Okay, so here, no. And should you do an RTK test? Yes, immediately, because we also know there could be asymptomatic transmitters, right? Okay. And then, can I return to work? Yes, if the RTK antigen is negative. Alright? And do I need to be monitored? Yes. You have to be monitored until day 5. You have to do RTK antigen daily until day 5 post-exposure for those who are fully vaccinated. So what is fully vaccinated definition? Those who have completed 2 doses of COVID-19 vaccines is considered completely vaccinated. If you have a booster, it's just an added protection. Okay? So if you're partially vaccinated, so just 1 dose, or unvaccinated, you need to do saliva test kit for 7 days. So during this period, what happens? You have to self-isolate despite not having symptoms, meaning work with strict precautions. You are a high-risk contact, but your RTK antigen has been negative. That's great news. But it could turn positive on day 5, day 6, day 7, or you can develop symptoms on day 8, day 9. So it's best to adhere to the strict precautions, work precautions, to prevent spreading it further to others. Okay? And then you've got if you're a high-risk contact and you have symptoms, okay, so what happens immediately? You'll have to do a saliva test kit immediately. If it's positive, you have to declare in the positive link, which we have attached below. And you have to, once you're positive, the pathway is different. But if you're negative, okay, you will need to continue your RTK antigen until day 5 and day 7, based on your vaccination status. Okay, if for the 3 days, if you're a high risk contact with symptoms, usually when you declare, we will actually give you a home surveillance order for 3 days, in which we will use it to monitor your saliva test kit. At any point at this time, the saliva test kit becomes positive, you go into the positive flow. So what happens if in these 3 days, your saliva test kit doesn't turn positive? but your symptoms are persistent, meaning persistent and it's worsening. Okay, so this would actually, the MO on call will actually further manage. We will probably proceed to a PCR. We'll probably proceed to a PCR and further manage. Will be further discussed with the ID team. Okay. So I hope that is clear. Okay, there's a little bit of there's a little footnote here. So source person is the person who is confirmed case of COVID-19. Asymptomatic healthcare workers within 90 days of post-COVID-19 infection can continue to work without restriction and they do not require testing. Okay. Household contacts are household contacts who's living or sleeping in the same room, same living room, shared accommodation. Okay, and if symptoms persist at day 3, the healthcare worker will be assessed with a PCR before they go back to work. Alright, so I hope this is clear. We have got the Malay version as well for those who find it easier to understand the Malay chart. Okay, it's the same thing. Okay, so this is actually the management of healthcare workers who are exposed to a person who is COVID-19. Okay, so now we know that flow. That was for close contacts. Okay, the list that, the flow chart is actually a summary of this chart. Okay, so this is just for further clarification. Okay, all right. Okay, what are the common scenarios and how do we risk stratify them? Okay, so this is taken based on the contact tracing team's exposure for the past 2.5 years. Okay, so I hope it helps. Okay, we have actually done it in Bahasa, in Malay, Bahasa Malaysia, because quite a number of staff requested that presentation be prepared in Malay, so that will help them work. So I hope this will be helpful. Okay, so scenario 1. Oh no, I checked my saliva test kit and I'm positive. Macam mana sekarang? Okay, so what do you think we should do? The saliva test kit is positive. The staff says the saliva test kit is positive. So don't worry, quarantine at home, fill up the link for the positive healthcare workers, which we have actually put here. And then you have to declare in MySejahtera and your HSO will be given in MySejahtera. If the symptoms becomes worse, such as they have developed shortness of breath, any fits, chest tightness, difficulty in breathing, please go to ETD immediately. Okay, so this is quite an easy protocol. Okay, and this is actually the positive link. Once they actually click on it, it will appear. Okay, so this is the second scenario. Okay, so what happens in the second scenario? Alamak, isteri saya positif. Macam mana sekarang? Boleh turun kerja sih? Okay, so what happens here? So we need to identify what is the risk factor. Okay, so for this, we go back to the flow chart just now. Okay. Okay, go back to the flow chart just now. All right. Can't see. Oh, sorry. Just give me a moment now. Okay, can you see? Is the flow chart visible? Okay. So in this case, isteri dia positive. So kalau isteri dia positive, it is a household contact, correct? Sorry, just give me a moment. Okay. Okay, so jangan takut, senang saja refer dengan guidelines. Okay, so kamu sekarang ialah high risk contact. Mengapa high risk contact? Sebab you have contact with a household dan dekat rumah tidak pakai mask. Okay, so first thing, we go back to the protocol. I show you the flow list, but this is how it is. You do a STK, check whether you have symptoms. If you do not, you can go back to work. If the STK is negative, you will do a STK for 5 days based on your vaccination status. Okay? If you have symptoms, do not come to work. Fill up the symptomatic link and the OSH-MO will call you to give you your HSO for 3 days. Okay? Alright. We will run through this again. So, in this case, you see, the wife is positive. So, a household is positive. It's high risk. Contact risiko tinggi. Okay. Jika tiada gejala, boleh lakukan ujian RTK segera, dan jika RTK negatif, boleh kembali ke bekerja dan dipantau setiap hari. RTK dipantau setiap hari sehingga hari ke-5 jika vaksinasi status lengkap, dan hari ke-7 jika vaksinasi status tidak lengkap atau tidak divaksin. Okey, dan selama tempoh pemantauan, staf hendaklah memakai face shield dengan face mask di semua bahagian hospital dan tidak makan bersama dengan kawan-kawan mereka. Jika staf itu bergejala, kita ikut flowchart kontak rapat risiko tinggi, ya. Patutnya dia lakukan ujian RTK, ya. Dan jika ujian RTK dia negatif pada hari ketiga, gejala berkurangan, boleh kembali bekerja. Jika gejala masih ada, RTK negatif tetapi bertambah teruk, kena sambung untuk 5 hari ataupun kena sambung untuk 5 hari dan declare kepada link OSH supaya doktor on call boleh call mereka untuk buat PCR. Okay? Okay, now we go to third scenario. Okay, so what happened to her? Okay, so staff nurse Ali positif hari ini. Saya baru saja makan dengannya semalam. Kami makan setiap hari dekat terapi. Boleh saya turun kerja? So, what do you think? What risk is this? Makan bersama, so there is no face mask. Sometimes we also receive, I've only eaten with the person once, or I ate twice, or it was a fast snack. But at that particular point, if both of the source and the contact was not on face mask, we will still consider that as high risk. Okay, at any point, no face mask, contact with the positive, we consider that high risk. Okay? So, what they will do, first, identify the risk factor. Okay, so this person would be a high risk contact. Immediately, buat a saliva test kit. If you have symptoms, please declare in the OSH link that we'll provide later. It's called a symptomatic link. If negative, continue doing saliva test kit for 5 days. If fully vaccinated, not fully vaccinated, 7 days. And if asymptomatic, you'll be able to come back to work with strict precaution. Okay? If you have symptoms, please do not come to work and just fill up the link and the OSH MO will call you. Okay, alright. So, the same thing back again, we follow. Right, now, okay, scenario 4. Fuyo, colleague saya positif hari ini, tapi nasib baik saya ikut SOP. Saya pakai face mask, face shield setiap masa. Tidak makan bersama juga. Kalau begitu, boleh saya kerja macam biasa? Perlu saya buat saliva test kit? Okay, so, she is which category? Which risk category? She followed SOP. She wore her face shield and face mask. So, ideally, she would be low risk. Okay? So, what happens low risk? Come, let's look at the table. Kontak rapat, risiko rendah. So, ada gejala? Tidak. Perlu buat RTK? Tidak. Boleh kembali bekerja? Ya. Perlu dipantau? Ya. 14 hari with strict precautions. Kena bekerja dengan strict precautions. Tapi, kalau kontak rapat risiko rendah, ada simptom, ada gejala, buat saliva test kit segera, boleh kembali bekerja? Ya, jika saliva test kit negatif. Tetapi, jika simptomnya semakin teruk, ataupun saliva test kit tukar menjadi positif, ataupun simptom semakin teruk tetapi saliva test kit hari kedua, seterusnya masih negatif, declare, and then kita akan proceed kepada PCR untuk further management, ya. Okay. Right. And then number 5, scenario number 5. Alamak, patient bed 25 tu positif PCR. dia selalu tidak pakai mask. Macam mana sekarang? Okay, so this is a very common scenario in our hospital, right? Yes, of course, everybody is enforced that everybody must wear face shield, face mask. But now we have, from our tracing, we have noted that a lot of clinical staff do not wear face shield. Yeah, they've taken, and they're only wearing face mask, or they wear double face mask as protection. But the source is not wearing mask, and the source is probably walking around the ward, probably use the toilets, the general toilets and things like that. And the source who has visitors who are coming in, who's probably also infected because the source doesn't wear mask. Okay, so what do we do in this situation? Okay, jangan takut, senang saja. Number one, 3 things you have to do. Refer to the ID team on call. Inform that there is a patient who is positive. Number 2, inform the infection control team, which is Dr. Catherine, so that they can come and do the terminal cleaning and also discuss regarding the patients and caretakers management. And then for OSH, refer to Annex 21 guideline, meaning the moment the patient is positive, what is the risk factors of this particular staff that was involved with this patient? Yeah. And then we follow the protocol. If there is the symptoms, if there are symptoms, fill in the link. All right. Same. So ideally, uncle is not wearing mask, but our staff should be wearing mask and face shield. If our staff is wearing mask and face shield, they will be kontak rapat risiko rendah, right? Kalau staff kita hanya pakai face mask sahaja, sekeping face mask sahaja, and you know that the face mask is a loose face mask, it's not N95, and you feel that you are actually a high risk contact, proceed to screen yourself first, okay? But if you're wearing N95 and you feel that the mask is really secure, it's fitting well, but you did not have much contact with the particular patient, then you can categorize yourself as close contact with low risk. But you can still do testing if you want. Okay? Okay, scenario 6. Okay. Kak, saya macam tiba-tiba ada demam, batuk, sakit tekak sejak semalam. Tapi si ada kontak rapat dengan kes COVID. Apa yang saya perlu buat sekarang ya? Okay, so this is a casual contact who probably turns symptomatic. Okay, this is likely to be something that this person might have caught from the community but suddenly develop symptoms. Okay, easy. What do we do? They will be, okay, so kalau kamu ada symptom tapi si ada kontak rapat, dikira low risk. Because we don't have any identifiable positive source to say that they're high risk. Sometimes, you know, restaurants or shopping malls and things like that. Okay. So we do a saliva test kit first and then declare in the symptomatic link, and our OSH team will assist you accordingly. Okay. So we go back to the protocol. In this case, contact rapat risiko rendah because there is no identifiable source. And we follow this protocol back again. Okay. Alright. So I've come to the end of the presentation. And I hope that the presentation has been clear. So do I have any questions from anybody that I can answer? Are they asking questions?
Or maybe open the chat. Open.
Okay, yes, of course. You can have the questions. the slides. Sorry. Yeah. Anybody else?
Hi, Priya. Can you hear me?
Hi, I'm so sorry. I can't hear.
You can't hear, huh?
The line.
Can you hear me now? I want to ask something actually.
Okay.
Dr. Shirley here from ETD.
I'm so sorry. I really cannot hear. Just give me 2 minutes, please. Let me just try to see if I can adjust my.
All right.
Maybe a volume. The computer volume.
Okay, sure. Okay. Can we try now?
All right. Can you hear me now? Boleh dengar tak?
Masih kena hear. Oh, just give me a moment. Yeah.
How about now? Is it better?
Okay, just give me a moment. I'm so sorry. I'm unable to hear. Probably it's my line. Okay, can we?
Maybe just type it out.
Let's do that. Okay. RTK positive. Apa jenis PPE? Okay. Well, I can speak it up, right?
Yeah, you can speak it out.
Okay. All right. I'm audible, right? Okay. So what is the type of PPE that healthcare worker have to use when they're dealing with the RTK positive patient? Okay. So if you're just doing a normal routine clinical rounds or just superficial examination, a facial face mask is okay. But if they're dealing with the CPR or they're doing any aerosol generating procedure, we have the minimum is N95 and a face shield and above. So if it's a CPR, aerosol generating procedure, even nebulization and also suction to a certain extent, N95 face shield or PAPR. Okay? The best would be N95 and face shield. We will also need the SHLOs to help our staff to help them identify their risk factors if at all they have some confusion. So if the SHLOs have any questions, they can always contact the OSHMO on call for guidance and we'll be able to help. The problem is right now, one OSHMO is on call, but he or she will be getting 10 calls at the same time. So we are unable to proceed with the positive, we are unable to tell what the close contact should be doing, So when all that happens, a lot of things get delayed. So that's the new way of going through things. Do we have duty quarantine for no? No circulars. Yes, Dr. Shirley, they have to start taking their own leaves, yes. Because this is a HR related protocol. OSH doesn't really, yeah. Okay, there's no official circular at KKM level for HSO or duty quarantine for COVID yet. Okay, Sister Julie, Julie TCM. Okay, if staff tested COVID positive, so still have to fill up declare positive link and MySejahtera. Then report to SHLO. So SHLO will identify the close contact at work, categorize the risk group according to Annex 21 protocol, then instruct staff to do what to do, fill up the link accordingly if needed. Am I right? So do SHLO need to send some list to of high risk? Okay, no. SHLO, okay, this is very well done. Yes, the SHLO can do that actually. They'll be really helpful because at the same time you'll be able to know what is your workforce like and or if all your staff is actually accountable for the history that they're telling. Okay, but you do not need to send any list to us. No. Okay, now it's just on your own. If there's any confusion, we will help. If there's symptomatic, yes, declare. Then from there we will proceed. If positive, declare. From there we will proceed. Asymptomatic, mild symptoms, low risk contact, no need. You don't have to do anything. Okay. Okay, this is from Sister Sabrina, I think. Contoh kalau staff lambat update dalam MySejahtera sehari atau 2 hari lepas. Okay, so this is why the moment they become positive, they have to declare the positive link because immediately they have to report their saliva test kit and immediately the HSO will come out within 6 to 12 hours of the day that they reported. Okay, we will not provide any manual HSO unless something serious happened in the sense that the phone really got spoiled or some uneventful thing happened. Only then we will actually consider. But otherwise, we have strict instructions to not release manual HSO for COVID positive patients, staff. Patients or staff. Once they become COVID positive staff, they become patients as well. So, yeah. Ada satu kes ni, staff kontak rapat sebab jaga anak positif. MO OSH cakap mereka tak akan beri HSO sebab staff negatif RTK and tak ada simptom. Dan staff ini mohon cuti sendiri. Tapi selepas itu dia call oleh PKB dan diberi HSO PKB. Mana satu dia nak ikut dia? Okay, good. So Renal, what happens here is PKB is on its own and HUS is on its own. Okay, I mean the management is different because HUS has to have its staff function. I mean, its workforce present at the minimum work, basically the minimum workforce present, so that the hospital can run. Okay, so ideally, if hospital, this is the protocol. But if PKB calls them and gives them a QO, they can actually follow the PKB QO, okay? But even PKB QO will not be so long. It will only be for 3 days. They cannot give 7 days or 14 days, okay? So this kind of cases, they can call the OSH team and we can actually assist them. Alright, maximum also is 3 days only. Okay. Sabrina, yang ni boleh ke kita call staff balik bertugas ikut date QO bermula dari date dia positif? Okay, boleh. Sebab kalau date dia positif, dia lambat, this case has to be referred to OSH and then OSH will decide when they can come back. Because if he has proof, okay, how do we know if they are positive, right? It's the link that they send to us. And then in that link, there will be pictures of their saliva test kit that's positive with the date. Once we have proof that that is the date that they are positive, yes, then we can allow them to come back to work as usual. But if they do not have that and then MySejahtera says 2 days later, I'm sorry, you have to follow the MySejahtera. Okay? So this kind of confusion, you can contact OSH M1 call. We will help you sort this out. Alright? Did I answer the questions? Renal, are you okay? Okay, Dr. Shirley, if their spouse is positive, the problem is no institution will allow the children to go to school or nursery. Okay. Yes, my concern is a lot of staff fake their symptoms as desperation measure to take care of their own children. Our manpower is always down. The supervisor may have trouble. Okay. Dr. Shirley, I would love to help, but honestly, I think this is beyond OSH. This one, you have to bring it up at a COVID ops room level meeting because they have to decide what is the protocol of such. Yeah. So I think the best would be bringing it up during the next meeting, but OSH has no power to provide HSO to all this because you start interfering with the HR system and Hermes and all those things. Yeah. So I'm so sorry, I can't help that part. Okay, Renal. Okay, so jadi dia boleh ikut PKB punya HSO jugalah. Okay. So SHLO kena update MOH ke sebab nanti ada isu nak claim annual leave yang dah dipenuh tu. Okay. Renal, for this part, right? Okay. You have to ask the staff to go and see HR. Give the HSO and then settle the annual leave part. Okay. If they ask OSH will probably talk to the admin side. Okay. Okay, this is Jacqueline. So pendek kata, if kita ada simptom, terus buat STK. And if negative and declare and terus proceed HSO 3 days, right? On the third day, kena ambil RTK sebelum mari kerja. I want to make myself clear first, but what if on the day 3 after taking RTK, symptoms still ada? Okay, Jacqueline, first of all, you need to identify which risk are you. Are you high risk or are you low risk? Okay, so your protocol changes according to your risk factors. So in this question, I'm not sure what is your risk. So you can go back to the, okay, you're telling me it's high risk. Okay, so if you're high risk and you have symptoms, meaning that you probably have the possibility of turning positive, correct? Yes. So you do a saliva test kit and if it's negative, we will give you a HSO for 3 days, correct? Third day, ambil RTK balik sebelum bekerja. Okay, on the third day, if your symptoms are improving and you have no more symptoms, you can actually go back to work, but you proceed with day 4, day 5 if you're fully vaccinated. Okay, if any time you become positive, declare balik. If your symptom persistent, after day 3 masih ada atau bertambah teruk, then you don't go back to work first. You just do saliva test kit, declare in the symptomatic link, and then the OSHMO will call you because probably we need to arrange a PCR for you. Okay? Okay. Sisters, yes, sister. Okay. Jika staff ada simptom, then sudah buat STK but negative. But today masih ada simptom. Adakah staff perlu buat STK lagi? Okay. Alright. Sister, you need to identify whether this staff is a low risk or high risk staff. So go back to the protocol, please. And then from there, you can actually decide what to do next. Okay, official SHLO. Okay, alright. This is my team. For high risk, STK daily for 5 days. The only difference is symptomatic kena HSO 3 days. Persistent symptom, update, declare in the link, in the symptomatic link, and we will guide you accordingly. Okay, Dr. Shirley. For symptomatic high risk, day 3 still negative. The PCR will be done on day 3 or day 4. Okay, this one will be done on day 4. And by the way, our Medical 5 healthcare worker swab booth is officially not actively running, meaning we are not open every day for PCR. Okay, we will only open once we have cumulative number of people to do PCR at a session or when there is a need to do it. So there won't be any MOs there anymore. Every symptomatic staff who declares will be given instructions on where to collect their MC, their HSO, and their medications. Yeah. Yes, on day 4, they will be on MC already. Dr. Shirley, right? Yeah, Dr. Shirley, day 4 they'll be on MC. If staff PUI can attend physical programs such as workshops and Intan, Fun Rachel. If staff PUI, okay, yeah. With strict precautions, please. Face shield, face mask. Okay, welcome.
Dengan menggunakan STK ada berbeda.
Dengan menggunakan STK, ada kemungkinan staff boleh menggunakan okay, this is from staff. STK, ada kemungkinan staff boleh menggunakan kesempatan dengan menipu result atau feature STK positif untuk tidak turun kerja. Okay, memang ada kemungkinan. Kita pun ada mengalami situasi yang sama sebelum ni. Yeah. But the official protocol says saliva test kit. We will be questioned why we are sending RTK. Okay, why we are sending PCR. Unless it is of really indicated, unless if there is a real indication for it, our samples will be rejected. Okay, so we cannot afford to waste samples and we have to keep answering because the protocol has changed. So we cannot do PCR. Okay, yes. Please, every STK that they send, they need to put their IC, need to write the time and the date that they took it with the brand. That is the thing that they use. Okay, doktor nak tanya, kita dah boleh buat program bersemuka kah? Sebab kadang-kadang belum berani bila melihat kes. Okay, this one is actually budi bicara jabatan. Kalau kita buat program bersemuka, kena pakai facial face mask and social distancing with an appropriate limited number of participants because now it's spreading like wildfire. Okay, so Nur Hafiza have to decide on that lah. Okay, Saf, ya saya sudah lama terfikir mereka akan guna kit yang lama sebab dia hanya picture. Okay, maybe Encik Saf, what we can, Saf, I'm not sure. What we can do is, we can ask them to bring the positive samples to work lah. Put it in a bag plastic yang, specimen and show. If staff itu sering kali ada symptoms. Okay, sering kali ada symptoms, sering kali MC and all these things. Usually our declaration will catch. Okay, because we have a database and a declaration will catch. So when that happens, we can actually we will actually investigate further. So the SHLO can update us about any malingering stuff and we can probably do the needful. Okay. Yeah. Okay, Oliver, right? Oliver, you're asking me a question here. Where is it? Down, Mosa?
Yeah.
Okay, Oliver. Yeah, okay. Okay, for high risk, asymptomatic if RTK negative, can return to work, but strictly SOP, continuing STK until day 5, yes. Symptomatic, if RTK is negative, 3-day HSO will be given, and investigation negative, day 3?
Yes.
Yes, correct. Correct. Sister Suhana, okay, this one is the likelihood of the management. Memang dia akan dapat PCR, tapi is when we have to discuss the case. Kadang-kadang mereka akan buat saliva test kit wrongly. We will actually call and ask them how do they do the saliva test kit, how long they put it, where is the place, how's the symptoms like, and all these things. And then if it requires to do a PCR, only then we proceed with the PCR. And if there's a PCR that's needed, they will do in day 4 or day 5. Yes, correct. Case by case, correct. What happened? Sister Noreen, you have something for me? Okay. Yes, correct. This is the sample. With the IC, we will need the IC as well.
If normal, then we
Yeah.
video call.
Yeah. Any more questions?
I think we can off the.
Yeah.
We just
This one.
close it. Close
Okay.
the session.
Okay.
Officially, so I can start the recording. Then we can answer.
Okay. Okay. All right. So we will actually. Thank you. Okay. We will finish with sister. Okay. Wait, Rachel. We'll finish the last one and then we'll end the session. Are we still allowed visitors? I don't think so. That one we have to check with the pengarah's directive. I don't think we've allowed visitors. Only to ICU if I'm not mistaken. And Miss Rachel, may I know if I strictly request my staff if balik kampung more than 4 days buat self-test? That is up to you, Miss Rachel. You can actually do, but there's OSH doesn't have a requirement for that. Okay, if they're asymptomatic, we don't ask them to swab. We don't ask them to test lah. That will be the latest directive. Okay, all right. Thank you very much. If there's any more questions, you can post it in the SHLO group or in this Telegram group, and I'll be more than glad to answer. Okay, I hope the presentation was easy to understand. I hope it can help us sustain the situation that's happening now. Thank you very much. Bye.